Okay, now we have case 2. We've got a 24 years old patient, gravida 3, para 1 with 1 abortion, with a history of cesarean section in the last pregnancy due to breech presentation. So this is her high risk. Currently admitted in active labor at 39 weeks of pregnancy. The cervix was 6 centimeters dilated, and the head was at 0 station 2 hours prior to this trace. This is also كمان not fully dilated cervix. صح ولا لا؟ طيب, our mnemonic. Let's define her risk. هل هي high risk ولا low risk? She is high risk. Her contractions. How many contractions does she have? هنا, this is my 10 minutes span. She had 1 contraction per 10 minutes. Her basal heart rate. This is my basal heart rate. حطينا اللاين وعند وين؟ عند 150. So her heart rate, fetal heart rate is 150 beats per minute, which is كمان normal. هل في accelerations? Yes, she does have accelerations, صح? Yes. Okay, so she has accelerations are seen. What's her variability? It's considered تقريبا normal variability. يعني ما كانت مثل هنا. شايفين here? It's very كذا small, كأنه small zigzags. بس هنا لا, there is a variability. Feet troughs so this, she has normal variability. طيب, what about decelerations? هل في decelerations and what type? Apparently she doesn't have any decelerations, which is a good sign. تمام? So this is my patient. Which category? She is in normal, لأنه ما عندها ولا high risk ولا anything that's abnormal. تمام? So we put her in category 1. We put her in category 1. تمام? طيب, category 1, what's the next step بالmanagement? Allow for normal delivery. So we wait for her to progress in labor because كمان احنا we only said she had 1 C-section before, but if she had يعني more than 1 C-section, then she needs to undergo another C-section. But 1 is allowed for a normal delivery in the second pregnancy. Okay? طيب. Okay, moving on to case 3. So we have a 30-year-old prima gravida, 41 weeks, كمان post-term, pregnant, presented with the spontaneous rupture of membrane. So this is her risk. And also she has meconium stained liquor. So كمان this is another risk. So she's considered a high-risk patient. Her cervix is only 1 centimeter dilated, 2 centimeter long posterior. So this is traced. Okay, this is her CTG strip. Let's follow our mnemonic. Let's look for the contractions. طيب, contractions قلنا, where do we look? Down. So okay, this is a weird looking صراحة CTG, but we'll try to read it. Okay, so this is my 10-minute span. She has only 1 contraction in 10 minutes. Okay. طيب, إيش بعد الcontractions? البasal heart rate. خلينا نحط our line. I don't know why is this line here حتى. So her baseline heart rate is above 150, as you can see here. So it is also a normal heart rate. يعني no, it's actually above 160. So the fetus has tachycardia. Okay. طيب. So let's look for the presence of any accelerations. ما في ولا acceleration, they're all decelerations. This is a bad sign. No accelerations. خلينا نشوف variability. So this is the variability, which is weirdly considered normal. مع إنه I don't see it normal, بس so she has normal variability or slightly reduced. We can say in يعني moderate variability. Okay. بس لا, look here. Yeah. So variability is normal. Okay. طيب, what about the decelerations? Does she have any decelerations? صح, she has. طب إيش نوعها? they are early. ليش؟ لأنه شوف, this is my uterine contraction. Guys, I'm sorry, I'm not very perfect at this case because it's weird صراحة CTG. I doubt they get it, but we're trying. So this is the uterine contraction, وعلى طول يجي معاها إيش the deceleration. So this is an early deceleration. صح؟ صح. طيب. So yes, خلينا نشوف which category she's in. So she has early decelerations with normal variability. So she is in category 2. Basically صراحة she can be in either 1 or 2. بس يعني definitely not 3. Okay? But since يعني she's only 2 centimeters dilated وما في severe labor, we would say she's in category 2. So a woman in category 2, what's the next step? Prepare her for C-section. ليش قلنا؟ لأن her cervix is only dilated 2 centimeters. We want to deliver her immediately. Okay? طيب, in case 4, this is also a not very clear one. So I'll keep it for you guys. طيب, خلاص, آخر case number 5. We have a primigravida smoker patient. So that's her high risk. Presented at 32 weeks of gestation with severe back aches and abdominal pains وmild vaginal bleeding. So أنا عندي 3 أشياء are signs of what? Severe back ache with abdominal pain or vaginal bleeding. This is إيش? Signs of placental abruption. Okay. كمان she also has an increased blood pressure, 160/100, her heart rate is 120. Also her abdomen is tense and rigid. This is the maternal blood pressure, not the fetal. Okay. طيب, خلينا نشوف أي category she's in. بس يعني most probably she's in category 3, but let's see. So أولا, she is high risk. Okay. Patient. What's her contractions? Let's see here. This is my 10 minutes. And she has 1 contraction in 10 minutes. What's her baseline heart rate? خلينا نحط our line. This is our line. So she the fetus has a 150 beats per minute basal line heart rate, which is okay. تمام. So does she have any accelerations? No, ما في any accelerations. Also a bad sign. Is there any variability? Yes, but very reduced variability, as you can see here. So reduced variability. And خلينا نشوف decelerations عشان نقرر which category she's in. So does she have any decelerations? Yes, she does have. إيش نوعها? This is my contraction and this is my deceleration. So it's a late one, late deceleration. Okay. So أنا عندي a patient with reduced variability and late decelerations. This is category 3. طيب, إيش قلنا cause of late deceleration? Placental insufficiency. وإحنا كمان because we said إنه she had a triad of severe back aches and abdominal pain with mild vaginal bleeding. Most probably she's having placental abruption. This is the cause of the placental insufficiency. Okay. And the cause of the fetal late decelerations. So category 3, إيش management? Immediate C-section. Thank you guys so much. I hope it was helpful.